Okay, we are live. That happened quickly. Hi, everyone. I'm Dr. Jennifer Gardella, and I have with me Kim Permar, the Executive Director of BCHIP. Kim, there is so much going on right now with BCHIP, or that has been going on. You take the wheels first. Tell us about the big event last week, and congratulations on its success.
Well, thank you. So good morning, Jennifer. It's good to be with you this morning. BCHIP is busy. It's just that time of year, and the next few weeks are busy for everybody in our nonprofit and healthcare world. So it's exciting. It's busy. We had the fortune of hosting our BCHIP annual event last week, which was fantastic. We had close to 175 people attending. It was all of our health systems were represented. We had many of our nonprofit partners in the room. We had a lot of our county partners in the room. Our legislators showed up. And so it was just a great event. We were thrilled to have you join us as well.
Always a good
Um,
event. Always a great networking event in Bucks County.
And I love that for the most part, everybody in that room has a shared mission or a shared passion, and that is to improve the health and well-being of Bucks County. And so it's just such an honor to be in the room with so many folks that are committed to the same purpose.
And your team there, what I loved also was that your team, Becky, Sam, they're on the floor, they're talking they're doing the things. And I'm going to throw you a huge compliment that you actually don't know is coming. You actually gave them the opportunity to be part of the program, which I don't see that often with higher ups and their teams, right? You weren't like, oh, this is the Kim show. So it was really about the collective group that was there and all of the people, including your team members, doing the work.
I appreciate that. Thank you. And you're right, because I'm really cognizant of the fact I don't want it to be the Kim show. And we are a small team, right? So
Right.
just because of the pure numbers, it's hard for it to not become more about like just some of the work that I'm doing. But we are a team, and Lord knows I acknowledge them at that event. We are a small but mighty team.
And you gave them the opportunity to connect in with people from the mic. And I was like, wow, they are really invested in the healthcare of Bucks County. It was really impressive.
Thank you. And they knocked it out of the park,
They
and they're
did.
not always so comfortable with public speaking.
Who is but us?
But they just did a great job. And I guess, we've been doing the event now for a while, and just the behind the scenes work that they do, the PowerPoint presentation that Becky made was just incredible. I'm hoping we can find ways to share that out on social media a little bit, some of it. So they highlight the work that we do, which is so nice, because then at the event, I didn't really have to highlight just the work we did. As you know, I was able to highlight the work that everybody does
Right.
around this work, which is really the mission of BCHIP, right? Is that true collaborative. And so, yes, we do good, valuable work. I do not want to minimize that at all, but we are just a sliver of this big picture in Bucks County. And I think what makes BCHIP so unique is that we really are about bringing those folks together to look at the big picture and acknowledge what everybody's doing in that world.
And I will say one of the highlights for me was hearing how you don't let people slip, right? Like you are, when you hear of an issue or when you hear of you personally, when you hear of coordination that needs to happen, you do not let people off the hook until things get done. And that, I think, is one of the big takeaways, is that you have a team there and your leadership is looking out for the best in Bucks County.
Well, that's true. And I think that's why everyone tolerates me so well, because, you heard, Jim Brexler from Doylestown, kind of alluded to the fact that they know when I'm calling that I'm relentless, right?
Relentless, that's what he said. She will call until you answer.
And I laughed, but I think they tolerate that because what's so nice about BCHIP is we have, and I personally have no other vested interest other than meeting the need of either that need, that particular like larger issue need, or that individual person's need that's
Right.
calling at the time, right? Because we're not a health system, we're not a county agency, we're not, we're
Right.
not really a huge service provider in the community, though we provide some service. But when I'm calling, it's because I know it's either an issue or a person that something's not right. right? And we need to make it better. Or there's a better way to do it. And so I think that's why they're so patient and kind to me and with my, and not resisting
Your
when I'm reaching out.
relentlessness, as they said.
Yeah. Yeah. So it was good. It was very good.
Good.
So the event was wonderful. Really appreciate the support we get. Gosh, like I said, I'm so humbled when I stand in front of that room and I look around and see so many really incredible leaders in the community doing such amazing work,
Right.
that take their time and come and celebrate with us at BCHIP and support our efforts. It's really, really a great event.
Yeah, and if you want to do better name tag collection at the end of an event, give people cupcakes. I was like, how do I get a cupcake? They're like, you have to turn in your name tag. I'm like, oh my gosh, that was brilliant. So you guys really thought about every detail, which again speaks to the organization, right? The flow of the room, all the little things that go into it. And then that PowerPoint, that's why I requested it, to start to get it out on your social media and share, like, these are all the things we do.
Yeah, it was good. It was good. So
Great event.
that was the big one. Of course, that's always, there's always some relief when it's over, like anyone that plans events, right? You're kind of,
Sure.
all right. So we already had our meeting on Monday to brainstorm things for next year and ideas for next year. So stay tuned because we have a really neat theme idea for next year, but I'm not
Oh,
disclosing yet.
okay.
But we'll see how that goes. But other work that's been going on too, had the pleasure on the same day as our event last week, as if it wasn't busy enough day, I had the pleasure to go to the community college and be a speaker for the first graduating class of the pre-apprenticeship healthcare program at the community college.
Okay, so what's the apprenticeship program?
So I'm sure, so if anyone from the community college is watching, I'm sure I'm never going to do it the justice it deserves, but I think it's incredible. It is a 12 or 13 week program.
Mm-hmm.
And it is an introduction to careers in healthcare. And those that attend get certified as an EKG tech. They
Yeah.
also get certified in phlebotomy. They get mental health first aid, CPR certification, and so it plants the seeds to expose them to different careers in healthcare. When they're done, they can walk out the door and get a job as an EKG tech. They could get a job as a tech in the hospital, various settings, long-term care. They can get a job, or they can go on for the LPN program or a CNA program or the RN program. So it opens them up and kind of it shows them and exposes them to the various programs the community college has that they can go to after this program.
Okay.
I just think it rocks. There were 13 students. I love that first of all, that we need pipeline. We need the pipeline for healthcare. We need healthcare. I mean, I tell everyone, if you want to be guaranteed a job, go into healthcare right now, right? Not an easy job, by no means an easy job, but boy, we need people in healthcare, from nursing homes to healthcare, to hospitals, to physician practices. We just need people, and we need people that care and are kind, right? And so the community college has this program because I really believe in career pathwaying. I am not an anti-college person. I think college is really great, but going away to a 4-year college isn't the only way.
Yeah.
And I think we need to just keep spreading that message to young people. And I think the apprenticeship program is such a great example. You're not sure what you want to do, but you think you might want to work in healthcare. Come try this out for 12 weeks. It's a free program at the community
That was my
college.
next question. What are the
Free.
details of it? Free.
Free. So you go to the community college for 12 weeks and you get these skills and you're like, maybe I like healthcare. Let me go work in it for a little bit and see. Or I know I liked healthcare and now I want to get some more education. So I just think it's such a great way to expose kids to different careers that is sadly considered the non-traditional way
Right.
of getting your education. So,
And so you were the keynote speaker at graduation. What'd you tell them?
I told them that I was, that they rock and that I was so excited for them to participate in this program and how needed, really, I emphasized how needed they are.
Yeah.
I think I said that probably at least half a dozen times. You are so needed. And so, please continue in this field if you are so inclined, because you're so needed. And so,
Absolutely. We were just talking before we clicked on the live, you try to get a doctor's appointment. It can be kind of tough to get services.
yep.
So you need to beef that up. Okay. So how'd you do keynote speaking?
Well, I guess okay, if I'm honest, but I wasn't at my best. A lot of balls in the air, I was distracted. So I think I spoke okay, but I don't know if I was able, I was nervous. So I don't know if I was able to get that passion that I'm probably talking better now than I did then, just because I'm not following a script and I wasn't worried.
Sure.
But I was really honored to have that opportunity and to meet them and to try to just encourage them in the future. So I
Yeah,
was
and you are
really, really,
such an advocate of, like you said, non-traditional college paths are not only okay, they're the best path for a lot of people.
yeah.
And we need healthcare workers. Is this a program, is it supported at all by other offices, or is it just a Bucks program that they're supporting at the college?
I believe it is just a Bucks program they are
Okay.
supporting at the
Because I
college.
know that there was some programs with the at the county level where you could get some certifications, but that's even another avenue that you've promoted
Yes.
then, for people to get
And
their
in fairness,
certifications.
they may be connected, Jen. They may be connected. I'm not positive. I know you're talking about the Bucks County Workforce and Economic Development programs
Right.
that people can attend. They may be connected on this project. I don't
No,
remember.
no. Well, whatever, guys, there's a lot of opportunity for Bucks County residents to update their skills and go, like Kim said, go try out another job. And we can't guarantee anything here, of course. My little armchair lawyers, we can't guarantee you a job, but certainly with those skills, you got a leg up in getting something interesting. Okay. So fantastic, Keenan. Now we'll have to call you Madam Speaker. That was a lot of public speaking actually in one day for you,
Yeah, yeah,
for anybody.
yeah. I was
Okay.
nervous. I was definitely nervous. So yeah.
Okay, switching gears, we're going to talk about the blue zones, which we have been talking about for how long has it
Wow.
been now? Definitely over a year.
It's been almost 2. Yeah.
Yeah.
So actually over 2. So yes, so another public speaking event that I had the pleasure of participating in with Senator Santisiro. That was a Blue Zone event that happened the week before. And the senator decided he wanted to convene the public again to do the report out that Blue Zones had shared with us a little while back. So the senator and I hosted another event at the community college. I spent a lot of time there lately, as if you can't tell. And it was amazing. Again, the attendance and the response to this initiative in the community just blows my mind. People are really interested and passionate about bringing a Blue Zone project here to Bucks County.
So why don't you take a step back, explain the blue zones a little bit, and then explain what a blue zone project would look like.
So Blue Zones is an organization that did research about where folks in the world live healthy, purposeful lives well into their hundreds. And they took theories, or they developed theories around those areas of the world. And they have then brought it to other areas to say, how can you apply the science to where you live to have more, to be more intentional about the health and well-being of your community?
Sure.
And so Blue Zones, the senator secured a grant over a year ago, and they came on site to Bucks County, and they met with key stakeholders like farmers, grocery stores, hospitals, physicians, schools, churches, municipalities, etc. They did a whole bunch of key stakeholder groups, and then they gave us an assessment of that work here in Bucks County with recommendations for next steps on how we can become we can become more intentional about health and well-being in Bucks.
Great.
So we have this blueprint, and then Blue Zones gave us a proposal to do this work themselves. And just speaking very openly, it's just too expensive. Their proposal was not within our budget. really at all here in Bucks County.
Right.
And so the senator and I have been talking about how we can move some of this work forward, not with a goal of becoming a true blue zone, but at least in implementing some small things that can make a difference in the health and well-being for folks at the most local level.
Okay.
So we've agreed that the project will be countywide. It will not just be in the senator's district. So I think that's really important.
Sure.
So we'll be meeting with the other senators that represent Bucks County to loop them into this project and to serve some of their communities as well. And we are looking to form an advisory board for Blue Zones through BCHIP.
Okay.
And then the next steps will be to secure a little bit of funding for leadership for this initiative. And then really tap into the folks that are so committed to it. We had a room of 200 people,
Wow.
and so it was crazy. And they love this work. At first, they were slightly disappointed we're not moving forward with a traditional Blue Zone project.
Sure.
But when we explained that, we just have some competing priorities here, and it just didn't make sense for our community to do it that way, but that we're going to do some work. Most, I think, are encouraged and on board. So we want to take that energy and really challenge those folks that were in the room to say, how can you, from a very grassroots level,
Right.
start implementing some of these practices with just a little bit of guidance, a little bit of resources. And so I'll be meeting actually with the senator again today to decide what next steps are for this project.
So when you work with the blue zones, and if you're out of your depth, that's absolutely fine. I don't expect you to rip out the report and start telling us, what, or calling it from memory. But what do they do that we can't do for ourselves in Bucks County?
That's a great question. What I will say is they have an expertise in this work that they've implemented in other places. They have evaluation tools I think are really fantastic. I think they have some scientific research behind them that they can implement and pull into some of this work. So I think they have resources that are very valuable.
Sure.
But the shortest answer I can say is, do they have anything that we probably can't do
That was my
or
question.
consult with
Right.
somebody else? Probably not.
Right.
So we'll see.
And I mean, a big piece of blue zones is bringing people together and having a sip of wine at 5 o'clock. So that's easy.
Exactly. Exactly.
But
Yep.
it is. And I think a big part that I'm learning also is when you talk about healthy lifestyle, it's getting unbearably expensive. I was in a grocery store yesterday and there was a $9 box of crackers. And I was like, okay, we've gone over the deep end. If that is, and it was a very healthy, don't get me wrong, it was a very healthy box of crackers. I did not dispute that. But and so I think if we start to bring resources where people can join gyms and eat healthier food. I think about you. I don't know if I've ever even told you this, but I did read the Blue Zones project and I read a book all about the Blue Zones, and Ikajai is what it's called. And, one of the things that they talk about is this magical purple potato that's grown in some areas of the world. And Wegmans carries the purple potato. And I'm like, I'm going to get Kim a bag of potatoes, but I'm never like at Wegmans when I see, when I'm going to see you again. So,
Got it.
but
Well,
yeah,
I know
like
Wegmans down the street, so maybe I have to stop and get a purple potato.
see and I don't know if it's the same purple potato as they talk about there, but it's like awareness. That's all I'm talking about is like, yes, there are healthier ways to live, or, park in the parking spot at the back of the lot and even just walk those extra 500 steps or whatever it's going to be. So,
One of the things that the senator and I really want to focus on that Blue Zones does a little bit of work on, but we want to really prioritize is that connectiveness to humans, right?
oh,
I think, as if the internet didn't do a lot of damage around that topic beforehand, then COVID just sprinkled the sugar on top. And I think it's just been really hard to get folks to be reconnected. And so looking for themes about what could bring people together, we have a lot of resources in Bucks County. We really
massive.
do. But I think some of the problem is folks just don't know, or they're all in their own silos. And so I see like one example that just came to mind for me is like music. So many folks may enjoy music, different types of music, all kinds of music. And we have so many different venues in Bucks County providing music. I just went to a concert at the community college. God, I didn't realize how often I'm saying that.
They're going to put you
Um,
on staff.
I went to a concert at the community college a few weeks ago, and we have wineries and vineyards and things that have music. We have
Yeah.
farms that have music. We have local municipalities that have music, right? So for example, could we just this is just a tiny example, but could we just get a list possibly of all the different theaters and places where all this is happening that folks could be aware of to join if music is your thing? And that's again just an example. We can do that around art. We could do that around athletics. We could do it around, but there's so many resources to connect folks to get them out if they only knew that it existed.
Well, and you and I have joked personally about, wanting to learn to play Mahjong.
Yes.
It's kind of hard to find a beginner Mahjong group. So could we have a list of
Yep.
rather than just hear about it piecemeal, or this person will teach you to play or whatever, even because you do, as you get older, you're looking for those connections,
Yes.
right? You're looking for shared activities. And it's also so important to expand your activities, like do things that inspire your mind. Stop scrolling. As the social
Amen.
media consultant, I'm going to tell you, stop scrolling. Like, I started gardening because I needed to get away from, and I'm allergic to gardening. I hate gardening, but I got out there because I really hate gardening. But I got out there because it's away from my phone. It's away from my computer. You're in the sunshine, but people aren't doing that. And you know what happened? I met a lot of my neighbors. They're like, what the heck are you doing?
Good, bad, or indifferent.
Right. I was like, oh, I'm tearing up my front lawn. They're like, oh my gosh. So I'm like, come and help, but you get talking then to people. But also, I noticed the people that passed me as I was tearing up my front lawn who weren't speaking. And I was like, hey, you can talk to the crazy lady on the ground in the dirt right now, but people aren't. It's like, unless you're on Zoom or in their safe zone of their house, they're not connecting, which is why I think this program is critical.
We'll see. Stay tuned for next steps.
Very fun. Okay. Well, I think this might be our longest video ever.
That's scary. Sorry, folks.
That was a lot of good info. You guys are doing, as I always say, you guys are doing great work. So
Thank you.
great event, great president, great keynote speech at graduation. And we really look forward to hearing more about the Blue Zones.
Thank you. Thank you for your time today.
Thanks, Kim. Stop that. Stop. And stop.